Hello and welcome to the Oakland County Megacast in the studios of our flagship stations 89.3 Lakes FM and Civic Center TV on Tyler Keefe alongside Ronnie Dahl. In addition today, we are as always joined on Comcast Channel 15 and AT&T Channel 99 in Birmingham, Bingham Farms, Beverly Hills, and the village of Rochester and village of Franklin. On Birmingham area municipal access. We're also on 88.1 WBFH, the BIF, a service of the Bloomfield Hills School District. As always, online, civiccentertv.com, and today, via Facebook Live, we are on the Facebook page, the journalist page of my co-host, Ronnie Dahl.
Tyler?
Yes, Ronnie.
So you know I'm a pet parent. Everyone knows we're a pet parent, right? Being a pet parent is fun.
Of course.
Especially when you don't have kids. So you have, this four-legged creature to entertain you. And we love Trixie Dixie.
Of course.
Except for at 12:30, 1 o'clock last night, when fast asleep, Trixie decides that's the time she wants to go out.
Oh,
and
not again.
I thought she had to go potty. So it's like, okay, let's go. No, she was just on a midnight neighborhood patrol.
Wow.
A sniffing expedition.
Yeah, gotta read that P-mail, right?
Oh my gosh! But then you come back, and I think every pet parent can relate to this. You come back, the dog goes right back to sleep, and then you can't fall back to sleep.
Of course.
You're awake. You've been outside in the cold air.
You've been up. You've been awake. You've been activated. You've been moving around. The cool air's been flowing on you. How are you gonna go back to sleep after that? Your day's begun at this point.
So it took me hours to fall back to sleep, and I started binge watching. It's the CNN series Exploring Italy.
Okay, yeah, Stanley Tucci.
Yeah, Stanley Tucci. It is really good, but it made me so depressed because last year we were scheduled to go to Italy, Florence and Tuscany and Rome in April, and of course the trip got canceled because of COVID. And I was like, oh, all those adventures I could have had.
Yeah, it's really interesting. I've seen a little bit of it. I just caught the very beginning of one episode, I think, after their documentary series on Abraham Lincoln. And so I've caught a little bit of it. It looks really interesting. It's something different they're putting on there. It's only really weekend programming. I think they're late Sunday is when they air it. But it looks like an interesting show. And maybe, a little bit of trip by osmosis for you after missing the Italy trip last year due to, of course, all of this.
I know. You really can't complain, though, because we'll get back there. But my niece was over there doing a semester abroad, and she was only there for a few weeks when she got sent home early. But I feel like her generation, they've lost out on so much because not only did she lose out on the trip, they go virtual, but now there's the big debate about some of these college graduations, and individuals were protesting over the weekend trying to get University of Michigan to change the decision to allow for an in-person graduation ceremony. So I believe they're going to still do some type of virtual ceremony because she'll be graduating in May. But I believe the Spartans and some of the other bigger universities here in the state of Michigan are going to be doing some type of in-person graduation.
Yeah, I'm sure that by that time there will be more of a partial in-person, maybe a partial virtual option because we'll be so far into the vaccination process. That's if we stay on the track that we're currently on. Of course, that can change, and it's changed before. But I think that a lot of people are very anxious and ready to go back to some semblance of normal as these numbers continue to drop, as the vaccinations provide more hope to the public. And they want to gradually get back there, but some want to get there a little bit quicker. And one of those rites of passage, especially for this generation, the current generation that's in college and it's in high school that are missing these rites of passage that have been in place throughout the generations because of the pandemic, and they've been through so much. I think that urgency is a little bit more there. So I would expect to see a lot of these universities maybe not go full in and say, fine, we'll do an in-person graduation, and anybody that doesn't want to do it can opt out, but give an option to have, if you want to be in person, you'll be in person, but you're going to be distanced. And if you don't want to be in person, we will have a way for you to participate or at least tune in virtually.
Right, do some type of hybrid situation, which we're already experiencing. And of course, some people have made the argument, if we can do the inauguration in person, why can't we do some of these graduation ceremonies in person as well? Because we're talking about our presidency, and while we want to see them being sworn in, I don't know if you really needed all of the rest of the pomp and circumstance in the middle of a pandemic when everything is closed down right now. Valid argument. You see where some people go on both sides of this issue.
Yeah, I can see that being a valid argument to a certain extent. I do agree that it probably didn't need to have all those additional people there sitting in the crowd. Distance.
We didn't need Lady Gaga singing.
No, we didn't need
She was great.
Yeah, she was fantastic. Everything, a lot of what went on at that inauguration was beautiful, but it didn't exactly have to happen there. It could have been just everybody that needed to be there. You know, the president-elect, the vice president-elect, the Chief Justice of the Supreme Court, maybe a couple other people to speak briefly beforehand, but it didn't need to have all the extra guests there. At the same time, that is a significantly smaller gathering of people for a ceremony than a graduation would be, with several hundred people in a individual college that's graduating all the parents.
Your numbers are wrong there. There were more people at the inauguration and all of the parties than we're talking about the big house. We're not talking about, you know, the stadium down the street here. I mean, it is the big house that seats, what, well over 100,000 people?
Yes. Yeah, 100,000 people.
Or why not have several ceremonies?
Yeah. Oh, that's another option, is to separate it into, you know, A through H. And then go down the line from there.
Typically, you
go
can
in
break
school
it
by
down.
school.
Yeah, you break it
and
down
even
by school.
Alphabetical order within those individual schools.
Yeah.
And just split up half and half. That makes so that everybody can have an in-person ceremony. There's plenty of distancing. You can break that up between a few weeks, really, even if it's before everybody has finished up their classes officially, and have it be a conditional graduation where you'll get your degree, of course, when you finish all your academics and pass all those classes, but it's a different option that's provided for people to still get what they want, but do it safely in a pandemic.
So we'll see if they end up changing or reversing that decision to some degree as it goes on. But, you know, more and more of these free college tuition programs are spreading across the state of Michigan. So tuition-free programs across Michigan now reaching to some of the four-year college campuses as well. It's a movement that appears to have been sparked by two new and widely popular free community college programs initiated by the governor, who made community college tuition free for most Michigan residents aged 25 and older in January, just months after she did the same thing for pandemic frontline workers. So there are at least 11 four-year colleges and universities with tuition-free programs for designated groups of students. When you include recently announced state programs offering free community college to most Michigan adults and colleges that accept students who qualify for a special scholarship for Detroit students, that number swells to at least 23 four-year universities and colleges and 31 community colleges. I thought this was a little bit surprising, but freshman enrollment was down an average of 7% at the state's 15 public universities last fall, because most likely it was tied to the remote learning, closed dorms, and safety concerns relating to the coronavirus. So they are trying to find ways to get more students educated here in the state of Michigan and making it affordable for some of these students as well.
Yeah, that's been a concern long before the pandemic. I think the programs that we've had throughout the pandemic, such as Futures for Frontliners, have kind of shown a blueprint for how this can be done to a certain extent, and providing some additional programs for people to get educated in the state will definitely help improve the return to the workforce and filling some of those jobs that have been lost, and workers that have left the workforce or maybe taken early retirement or have moved on to different career fields over the course of the pandemic by providing more opportunities for other people to potentially get into those career fields and down the line or immediately take some of those jobs.
So how well is Michigan protecting children during COVID-19? A new report looking at the impact of the coronavirus pandemic on children shows how kids in Michigan are faring compared with the rest of the country. So the report is from Save the Children. It looked at data from a biweekly survey administered by the U.S. Census with the aim of understanding the impact on children and where they have been most and least protected during the pandemic. The group says it looked at food scarcity, lack of access to remote learning tools, and difficulty paying for household expenses. Michigan, Tyler, ranked 32 in the child protection rankings. The data from the end of 2020 shows that in Michigan, 18.3% of the kids did not have enough to eat. 12.5% of kids had inadequate tools for remote learning, and 46.2% of families had difficulty paying the bills. And despite the rankings, though, the report does note that families in every state and at all income levels are suffering, with poorer families struggling the most. There was a great piece last night on 60 Minutes, I don't know if you caught it, where they're looking back at 1 year into the pandemic, and they went to Ohio and looked at some of the people that are struggling the most, some of the students that have found themselves homeless, and remote learning as well. It's not even enough to have one computer. A lot of times you need two, because you're looking up information on one while you're in on your Zoom conferences and this, that, and the other. It really is a sobering look at what the virus has done to our nation overall.
Yeah, definitely it's taken a toll in many different ways. And looking at these numbers, you kind of see the extent that it has taken on families, and particularly on children. You talk about how much of a rush they're seeing, and we've talked a lot about how much of a rush there seems to be to get kids back in person as quickly as possible and as safely as possible. Part of that is because of this 12.5% of children having inadequate tools for remote learning, despite a lot of school districts, where possible, whether through their own funding or through federal funding or both, providing a lot of those resources to these kids. It's still not quite enough for a lot of kids who are in families within that 46.2% of families that had difficulty paying the bills, that may not have access to the internet or reliable access to the internet for remote learning. So we've seen the toll that this has taken on children during the pandemic. We're yet to see how big of a toll it's going to take on families and on children post-pandemic as they come out of this, but it's definitely been having a major impact. And really interesting article here that kind of gives some more details as to how much of an impact it's had as of now, as far as we know.
So today starts a new day in the chapter of vaccination here in the state of Michigan. Michigan residents age 50 and up are going to be able to get vaccinated starting today as long as they have a pre-existing condition. Some of those conditions including cancer, diabetes, overweight, smoking. So there is a whole list of some of these, issues that you need to have. However, keep in mind, just because you can sign up and you are eligible now doesn't necessarily mean you're going to be vaccinated anytime soon, because so many counties are still trying to catch up on the backlog of some of the individuals that are 65 and older. So keep in mind, it is still smart to go ahead and try to schedule that appointment now rather than later, because it could take you a while to get in. And keep in mind, on March 22nd, everyone in the state of Michigan that is 50 and older will be eligible to receive the vaccine across the state, which is why if you qualify, it's best to set up your appointment as soon as possible. These vaccines are free of charge, but you do not have any say on which of the 3 vaccines you receive.
And as we've heard over the last several weeks from medical experts that we've spoken to, and in other forms of media and in the mainstream media and the news especially, is that you really shouldn't be making the choice between these 3 vaccines unless there's a big medical reason for it, because frankly we're trying to get people through the lines. These vaccines have all been checked out and have been approved for distribution. They're all safe and efficacious vaccines, and we're trying to move people through the lines, get this process out of the way so we can start to reacclimate ourselves to quote-unquote normalcy. So if you haven't signed up, you should definitely sign up and get yourself in as many lines as possible. And when your time comes up, take that chance, no matter what vaccine it is, whether it's the 1-dose Johnson & Johnson vaccine or one of the 2 doses such as Pfizer or Moderna.
So we'll talk about this a little bit more in just a few minutes. Dr. Russell Faust will be joining us here on the Megacast. He's the medical director for Oakland County Health Division. He's been such a great resource for us throughout the pandemic and trying to help break down some of this information. So we'll be speaking to him in just a few moments. But just as a reminder, you can always catch the latest headlines. Just go to civiccentertv.com and click click on the coronavirus tab. We're going to take a quick break here on the Megacast, and when we come back, we'll get the conversation started with Dr. Faust. This is the Oakland County Megacast.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Great to have you with us here on the Megacast. As a reminder, Tyler and I are here Monday through Friday, 10 a.m. until noon, trying to continue to navigate the COVID-19 crisis and break down the information for you. And with that, there is a lot of shift and a lot of focus right now on the vaccines that are available for COVID-19. We are hoping, because it was about a year ago this week that our country started shutting down due to this virus, but now the focus and the hope is on the vaccine, but there's a lot of questions between the vaccines. Which one should you get? So to join us now and talk a lot more about this, let's bring in Dr. Russell Faust. He's the medical director for Oakland County's Health Division. Always great having you with us.
Good morning, and thanks for having me.
And I will say happy Monday, and it looks like it's going to be a beautiful spring day.
Yeah, and happy COVID anniversary, or not so happy as it turns out. So, but yeah, a year now.
So was it a
long year?
It's been a very long year, and if we only knew back then when they talked about shutting things down for 2 weeks to flatten the curve, if it was the different decisions we all would have made, right?
Yeah. We've been fortunate, actually, to live in Michigan because I think the public health officials did a very good job, better than most states.
So I know a lot of the focus right now is on the vaccine. And of course, today, the big news is people that are 50 years and older that have pre-existing conditions are now eligible for the vaccine. What are your thoughts on expanding that when it seems like there's still an issue in trying to get others prior to this group vaccinated? Is it just going to bog down the system?
Yeah, I was listening to your chat before the break, and I appreciate your comment that just because you are now listed as eligible doesn't mean you necessarily have access to vaccine. And that has been an ongoing frustration for us here in Oakland County Health. But when I look around the state, there are actually health departments in some very small jurisdictions, small populations, who really pretty rapidly kind of move through their 1A and 1B, eligibility categories, populations, and they're ready to move on. And I think so the state MDHHS helps them out and says, let's open it up so that they can, legitimately or legally go ahead and vaccinate those folks. We here still have something like 300 or 400,000 people on our waiting list, which, seems like a lot, but let me qualify that by saying a lot of people treated it as though it were a lottery. And so many people signed up like 10 times thinking that would increase their chances of being called up, and it just doesn't. So that 300,000 or 400,000 on the list includes a lot of duplicates, or I should say multiples.
So with that, too, I was wondering the other day, because I had a friend who was able to actually get the vaccine in Detroit because of his employment, but is on the list. Is there a way for people to remove their name from the list? Will that help out the process and your team back there?
Yes, and so I'm glad you asked. Thank you. So the way to get on the list, let's talk about that first, is to go to oaklandcountyvaccine.com. Not vaccines, but oaklandcountyvaccine.com. Click on the big blue button that says Save Your Spot. That'll get you on the list. No matter who you are or what your eligibility is, you should do that now. The sooner you get on the list, the better. Then when your eligibility population comes up, you will be contacted when we have adequate vaccine. If, and you should, but if you're signed up on multiple lists and you get vaccinated someplace else through one of the pharmacies or your healthcare system, your hospital, please come back and go to oaklandcountyvaccine.com, and I believe it's the gray button that says remove me from the list. And let me emphasize, people should sign up on multiple lists. They have access to, various hospital systems, pharmacies, as well as Oakland County. And historically, we've received kind of the minority of the amount of vaccine that's been distributed in county. Of more than 250,000, I think 300,000 or 400,000 doses that have been administered in Oakland County. We've been less than a third of that. So, you have a better chance getting vaccinated by your hospital, for example.
Yeah, so that's a good thing to know for people. Remove your name. Make it easier for you and your team back there to get through that list as well.
We do spend a lot of time kind of, vetting the list, kind of weeding through it, but we're getting through it.
So how does it work when we're talking about eligibility? Who is checking that? Or is it kind of an honor system?
Well, obviously, if it's an age-limited eligibility, 65 and up, you have your driver's license or ID that has an official date of birth, that makes it pretty easy.
Yeah.
And honestly, beyond that, beyond kind of the age brackets, we're not really requesting proof. Now, if you need to be a healthcare worker, obviously you have a name badge for your healthcare system or your doctor's office or wherever it is you're working. Those things are easy. But issues such as, I have chronic heart condition or kidney condition or diabetes, we're not asking for a doctor's proof that you have these things. And, honestly, between just you and me, all I care is that we get vaccine into somebody's arm. We just need to vaccinate more and more people. So really the frustration or the limit for us is not adequate vaccine. And, when I look at, and so a couple things people can do. They can go to oaklandcountyvaccine.com and scroll down and look at the doses we've received and the doses we've administered in arms. And that's in a table there. They can also go to oakgov.com/COVID/dashboard and actually look at case numbers, and those two sites will give you a really good sense of what's going on in Oakland County. But early on, we received fewer than 2,000 doses a week. 2 weeks ago, more than 18,000 doses. Last week, more than 20,000 doses. So, things are moving in the right direction. More doses are being received across the state, across the nation, and nationally, I think we're doing very, very well. I think we're over 2 million doses a day being administered right now nationally. So that's where we need to be.
Dr. Russell Faust with us here on the Megacast. He is the medical director for Oakland County's Health Division. We have to talk about the differences in the vaccine because,
yes, please.
And one thing we're used to in America as consumers is to be able to pick and choose what we want and what we don't want. But in this case, really you have no choice. It's go get the vaccine. It doesn't matter which one is available.
Thank you. But yeah, even when all we had were the 2 mRNA vaccines, which are virtually identical, they both code for the spike protein. Even then, a month or two ago, I was still getting people in line that would insist, they were brand shopping. They were insisting on one or the other, the Pfizer or the Moderna. And we're still getting that. And as we move forward with the Johnson & Johnson or the Janssen added to, our available vaccine, we're going to have more of that. I urge people not to brand shop. If you get called, if you receive the email to be vaccinated, please just get vaccinated. I mean, honestly, if it were up to me right now and I were not already vaccinated, what's not to love about a single dose? I would just get the Johnson & Johnson. And let me emphasize this. People are hearing or reading these numbers of success rates or efficacy between the various vaccines and comparing them. You cannot compare clinical trial results that were just run recently to clinical trial results that were run for Pfizer and Moderna a year ago. The various variants did not exist a year ago. And now the Johnson & Johnson clinical trials have been run in places like South Africa or Brazil and the United States, when we have variants that are just rampant in the community. So those numbers, they're comparing apples to oranges. They're safe, they're effective, just get vaccinated.
What about the news that's been coming out recently, obviously, about some of the religious leaders in the Catholic faith telling people if you're going to get vaccinated to choose one or the other? Why is that? What are your thoughts about that?
Yeah, certainly I respect that, and we have to respect religious practices and religious beliefs. And certainly there will be people that don't want the Johnson & Johnson or prefer to get the Pfizer or Moderna and may tell us that, they need to do that on the basis of a religious belief. And that's fine. We're not going to be asking for proof of religion. But I will say this, we have been pleasantly surprised over the demand for the Johnson & Johnson. I mean, I've been quite surprised. I expected there to be a little bit of resistance to the Johnson & Johnson based on the numbers that we see in the media. And in fact, we're out of it. We received something like just over 7,000 doses, and they're all spoken for now, which I was surprised at, frankly. It's a good thing.
Yeah, it's one of the things I'm interested to see how it's going to play out as the vaccine becomes more widely available and distributed through various entities, such as some of our pharmacies and other arenas and areas, because the Johnson & Johnson doesn't need that, super cold freezer for it to be stable. So it seems to me that that's going to be a safer one to put in people's arms, because the more people that put their hands on this vaccine, let's just say that you can't always trust people in doing and following the proper procedures and protocols.
And that's a great point. I mean, I think it's a little more reliable now. And I think that's why there's been such demand by our various partners. We've now become a distributor of vaccine in Oakland County. And we had been sharing and supplying our various partners, our hospital systems, Henry Ford and Beaumont, the 3 or 4 hospital systems in county, as well as private groups, agencies, organizations, the Honor Health, Community Health, for example. And the Johnson & Johnson has been very popular just because of the logistics, the ease with which it can be stored and administered.
Right, because if we're going to start doing them, I know in Detroit they've started reaching out to some of the churches as well as some of the community centers. But if, you know, the Pfizer and the Moderna have to be kept at those super cold temperatures, you're not taking in one of those specialized freezers to the community center or the church. So how is all that working, or that's part of the discussion as you're distributing the vaccine?
That is part of the discussion. In addition, last week, CDC came out with a policy adjustment that the Pfizer vaccine can be treated exactly as the Moderna is. So we no longer need the super cold freezers, the -80, -90 degrees Celsius. So that does open the logistics somewhat. But in fact, you know, the mRNA vaccines, because they're based on RNA, are certainly a little bit more fragile than the DNA vaccine of the Johnson & Johnson and the AstraZeneca for that matter.
Explain the differences again.
So very quickly, the mRNA vaccines takes the codon or message RNA, wraps it in a lipid nanoparticle, and they just inject that into your arm. It's taken up by your cells, and your cells use that to translate it into protein. The Johnson & Johnson is based on getting a DNA copy into your cells, and it adds one more step. So that DNA then needs to be transcribed into RNA, and then from there, it's identical to both Pfizer and Moderna. That is, it's translated into protein, spike protein spit out. So it adds one more step in the cells, but the DNA is certainly more stable than RNA. RNA is fragile. Because we have evolved with many RNA viruses, our bodies are full of enzymes that chop up RNA, and it doesn't last long.
So if we can take a moment to talk about COVID-19 testing, because we are seeing the numbers go down quite a bit. Is that because not as many people are getting tested right now?
That's a great question. And certainly that's one reason, but I will point this out. If we look at the important number there of those people who are getting tested, the number that are positive, that number is also going way down. And so what we really were being told by World Health Organization and CDC early on in the process is that to minimize transmission through the community, we want that positivity rate to be less than 5%. And we're well less than 5% right now. We're somewhere around 3%. Now, where you want it depends on how easily it's transmitted. And now that we have variants starting to be common in the community, certainly I like that positivity rate to be 0, but it's certainly down, and that's reassuring.
So now it's like not only are we fighting COVID-19, but now it's the news about all the variants, like you just mentioned. We are, for so many of us that are in the public, we're not medical people. We don't have your expertise or your knowledge to break it down. So we like to kind of associate it to something. So the easiest thing is to say, oh, it's like the flu, and it's a new strain of the flu. And the vaccination doesn't always work against that strain, but you still get vaccinated. You still get your flu shot. Is that a fair comparison?
To a certain extent, it is. In this way, it's a fair comparison. Both are RNA viruses, and because they're RNA viruses, they mutate fairly rapidly. That is, when you get infected and they make a copy, the virus makes a copy of itself, it doesn't do it with great fidelity. It doesn't do it 100% accurately. And so every time it makes a copy, it makes mistakes. So that results in variants. Influenza does that at a phenomenal rate. So over the span of a year around the globe, there will be 1,000 or more variants of influenza that come up. And so when they make the influenza vaccine, CDC and World Health Organization look for the 4 worst, and they make a vaccine against those. What we're seeing with COVID is for people who are infected over a long period of time, those variants begin to accumulate. and those become a problem. The ones that are out and become a common strain become more prevalent because they're more easily transmitted. That's what their variant does for them. Fortunately, all of the variants right now are still sensitive to vaccine immunity. So that's all good news. And it will take many, many, many mutations for them to become resistant to vaccine-based immunity. So far, so good. But what this means is that we're frankly in a race to get as many people vaccinated as possible before a resistant variant pops up.
That's good to know. I think you're the first person I've heard put it like that, and it breaks it down for the general public, because I would imagine a lot of your time for you and members of your staff trying to re-explain so much of the disinformation that is out there in the public. It has to be a bit frustrating. So is this something like, should we anticipate that we're going to need a booster shot, or just like you get the flu shot every year, you get a COVID shot?
It's a great question. I don't know how many times a day I get that question now. Right. I honestly can't predict, but again, I will say we're in a race. Right now, I'm cautiously optimistic. We're vaccinating people at a great rate right now. I think if we continue like this, we will beat the time when perhaps a resistant variant does come up. I'm hoping that we avoid needing boosters. And I think at this rate, we might need a booster. Here's the other issue. Even if we get everybody in the US vaccinated, there will be countries out there that are not being vaccinated. Mm-hmm. So let's say countries in Africa that are not being vaccinated, and those folks are going to be getting infected with COVID-19, and as they're getting infected, new variants will be coming up. So a year or two from now, one of these variants is going to come back around the world, and we will no longer be immune to it. And that will be a problem. We need to get everybody on the planet vaccinated to put an end to this pandemic.
So it really is a global issue, and it's a reminder that we are all in this together. I mean, literally, we are all in this together, but we do still have a huge portion of the population. They do not want to get vaccinated. But do you think we're going to get to a point to be able to go places and live life like we used to know it? You're going to have to show that you were vaccinated.
You know, what I tell people in the vaccine clinic is to take a photo of that card that has their vaccine sticker on it, so they have it permanently saved in their phone or in the cloud. Because I fully believe that moving forward, proof of full vaccination will be your passport to participate in all sorts of activities, whether that's travel or go to a restaurant or what have you.
Right. I mean, even now to travel, a lot of places, if you're going internationally, you have to show that you have a negative COVID-19 test. With that, when we're talking about the testing, there was so much focus earlier in the pandemic because so many of the tests were not 100% reliable. Has it gotten better, the testing process, especially now that fewer people are getting tested?
So one of the biggest frustrations for us have been the rapid antigen tests and rapid antibody tests. And there were a lot of fly-by-night companies that were just using the panic of the pandemic to print money, to earn money. Those have sort of gone by the wayside now. And most of the tests that are out there and available that are being used and are being approved, frankly, by FDA are quite reliable.
That's good to know. I just heard a commercial, maybe it was on a podcast, about being able to do a COVID-19 test at home without doctors and without putting the big swab up your nose and getting the results back at home. It was almost like a, at-home COVID test, like a pregnancy test, right? So, and I'm wondering, are those accurate, or is it what you're saying, they're just trying to get your money?
No, I mean, there are some at-home tests that have been approved by FDA. I don't want to get very technical. I'll try. But
Thank you.
The accuracy of a test oddly is determined by your pre-test probability of having the disease or having the condition. And so, if you have 1,000 people that have not been exposed, have a very, very low probability of being infected with COVID-19 that are doing tests on themselves, you're going to see a large number of false positives. So the accuracy is going to depend on pre-test probability.
I was watching 60 Minutes last night, and they were talking about, some of these trials are still going on. There was one drug that was an antidepressant drug, I forget the name of it, that is now being used as part of the treatment for COVID-19. They're, still in the studies. How important is it for people to still volunteer for some of these studies?
Oh, it's crucial, because moving forward, there may be a fair number of people that we don't get vaccinated that do become infected with COVID-19, and we absolutely need treatments as well as preventives. So I think it's important that people continue to participate in trials. Absolutely.
Dr. Russell.
Let me also say, though, that our fatality rates have come way down, and it's because our hospitals have become so experienced and so incredibly good at treating and managing these patients when they do come into the hospital. They come into the hospital, they give them antiviral, they suppress the immune response so that they don't end up on a ventilator, they don't end up flooding their lungs. They're getting these people out of the hospital now. They're doing just a phenomenal job.
They really have been so many heroes on the front lines throughout this pandemic. Dr. Russell Faust with us here on the Megacast. Just another minute or two with you here on the show. I had a friend who did get the first shot of the vaccine, but then a week later tested positive for COVID. How does that happen?
Well, getting vaccinated doesn't prevent you from being exposed. And unfortunately, there's quite a few people that think that once they're vaccinated, woohoo, they can go out and party and, be exposed. That is, hang out with people without a mask, etc. And that's just not the case. Even if once you're fully vaccinated, we need to continue to mask and distance and avoid indoor gatherings of people. And there are many reasons for that, and we don't really have the time to go into all of them. But the fact is, there's still a lot we don't know. We don't know whether, even though you're fully vaccinated, whether you can carry the virus, be just superficially infected, not be symptomatic, but still transmit it. We just don't know that yet. We're gathering the data. We should know it soon. I'm expecting there to be changes in those quarantine policies from CDC soon. But even once you're vaccinated, don't just throw caution to the wind.
Dr. Russell Faust with us on the Oakland County Megacast. He's the medical director at the Oakland County Health Division. Dr. Faust, with that, we've seen other states, particularly Texas, in the recent weeks, lift some of their mask mandates and mask orders on local levels and on state levels. What are your thoughts on those decisions as we are at a point where more people are getting vaccinated and we seem to be getting so close to being near the end of this? Is this too early, and what impact could those lifting of mask orders possibly have on this process of us getting out of this pandemic?
You're just pushing my buttons now.
Of course. I got to do it.
Yeah. So I believe there are 14 states now that have lifted some of these precautionary policies. And I think that's just absolute idiocy. I don't know how to put it more plainly than that. I mean, this is a marathon. It's not a sprint. We're nearing the finish line. It's not time to stop running. We really need to keep pushing. We need to remain vigilant until we put an end to this pandemic. And this kind of behavior is not going to do that.
Dr. Russell Faust with us. He's the medical director for Oakland County's Health Division. Dr. Faust, we always appreciate your time and also taking all of our questions and clarifying so much confusion that is out there. We appreciate it, but also we want to give you guys a big shout out. Your team has been doing an amazing job with some of these vaccination sites and working around the clock to make this happen. So we want to say thank you to you and your entire team as well.
Thank you very much. Yeah, my team is just outstanding.
Well,
So,
let's
thank
hope
you.
when this is over, you guys get a very well-deserved long vacation, and we don't go through another one for another 100 years. Dr. Russell Faust with us. He's the medical director for the Oakland County Health Division. We're going to take a quick break here on the Megacast, and when we come back, we'll be speaking with the director of the Brown program, a program that is vital during this time for people with dementia. This is the Oakland County Megacast.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask.
Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together.
Together.
For the latest information, visit oakgov.com/COVID.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. Our apologies to our next guest for running a little bit long, but anytime we can get Dr. Faust or one of our medical experts on, we like to take the time to have them explain exactly what is going on with the vaccination, because there are so many questions, and it's great to get it from the experts directly. You can always catch us on Civic Center TV, Birmingham Area Municipal Access, Channel 15 on Comcast, 99 on AT&T. You can also tune in the Megacast, 89.3 Lakes FM, 88.1 FM The Biff. And while we all continue to navigate the COVID-19 crisis, this time has been especially hard for so many of our adults living with dementia. With us now on the show, Debi Banooni. She's the director for the Brown program. Great to have you with us.
Thank you so much for having me.
Debi, tell us first, what exactly is the Brown program?
It is the Dorothy and Peter Jewish Community Adult Day Program. It is a day program for people who are living with dementia, as well as providing services to their care partners. You are so vital, and your services are so vital. But what's it been like in the middle of a pandemic right now? So, we all hear about what isolation can do to us at any stage of our lives. And while you live with dementia, isolation is a way to fasten that progression. So for us, it was vital that we turn things around very quickly. I believe our last day of in-person services was March 13th-ish. And by April 1st, we had a virtual program in place where we would invite all of our participants with some assistance as needed from their care partners to log in. And once a week, we have our music specialist come in. And the other weekly program is a variety hour, which includes brain games and poetry and chair exercises, anything that we can think of.
So have you returned to any type of in-person programming?
We have not, but I'm glad that you asked, because we are hoping to start a phased opening early April, where we'll bring back those of our participants who are able to comply with our new safety protocol, either on their own or with some assistance from our staff. And then once we've started our phased opening, we can start to bring everybody else back and welcome new participants who we have had many calls about, people who have been recently diagnosed and could really use that extra support and socialization.
I'm thinking about this, and dementia is a very hard disease for people to live with, but the stress on the caretakers as well. So when you had your in-person sessions, it was probably just as important for the caregivers to be able to get a little bit of time to themselves. So what's been the response from that side of the house?
So absolutely, it is a very difficult job, burden of love, we would say. And so we still do see that sometimes our care partners, they know that their loved one is enjoying a program that we're offering, and they might take a few minutes during that program to walk away and take care of something in the kitchen. It's not the same. We don't have them in-house for multiple hours. They can't necessarily leave their loved one alone, but it does give them some respite. And we have tried to continue to take care of our care partners. They mean so much to us, and we have sent care packages to them specifically with, tea and mugs and fuzzy socks and warm blankets, reminding them that in order to take care of somebody else, they need to remember to take care of themselves. We moved all of our support groups virtually, so they have once a week, they're able to attend support groups at different times during the day. And we also started a group called Connections, which is run by our social worker, but it is not social work themed, so to speak. It's an opportunity for people to get together and interact and socialize during this time of isolation.
Debi Banooni with us here on the Megacast. She is the director for the Brown program. What's been the response from the caretakers?
They are very eagerly awaiting our opening announcement. However, they have said that the care packages for them meant so much and were so important, and the majority of them, their initial response was to look at it as a gift for their loved one. So we have really worked to remind them that they have to take care of themselves as well. And they have said that there is a huge difference with our programming in that they see energy that might not have been there before. Their loved one will log on and see their friends and people that they may not remember their names, but they recognize them, and the personalities mix and they chat with each other, and it is just a wonderful experience for them. So our care partners have been very happy, yet would still prefer we, as soon as safely possible, bring everyone back in person.
So many people and organizations have had to do what you're doing and go virtual during this pandemic. But as you're able to start to bring people back, has there been a positive for your organization that's come out of this crisis that you think will stay in place post-COVID?
So absolutely. We had not done any virtual work in the past in the way that we are now, and we have people that have reached out to us out of state that are participating in our program now. And so I think building a bigger community, yet stronger community, will be something that we continue and appreciate. I think that we will maintain our virtual presence. We have people that, due to illness, even if it's not COVID, may not be able to come into our center. However, it would be a benefit to them to still be able to participate in some of the activities that we're having. So we learned a lot through this process. We appreciate it. We've built some strengths that we didn't know that we had. And we'll continue those things that have been very meaningful.
So from, I know that there was one study that said people with dementia are twice as likely to get COVID-19 than people without dementia. Hearing from some of your clients, has that been the case for some of your clients at all, do you know?
I would not. I'm only comparing it to a small group, so I can't necessarily say if that's twice or not. I do know that a lot of our participants have been very strict about isolating, which puts them in a safer category. So, you know, we have had, you know, some participants with COVID. Now, we were not in person, so they weren't interacting with each other. However, I think that they have done a very good job of keeping themselves separate, which is another danger for people living with dementia and their cognitive and physical abilities.
Debi, I'm wondering, how do you guys come about trying to develop your programs, your virtual programs? Because for some of us without dementia, it's hard enough for us to stay focused in some of these Zoom meetings that go on. So did you have to come up with a different way to do some of these virtual programs to be able to get the attention and keep the attention through a computer screen?
So I think in some ways, yes, and in some way, no. I think that we run a program that is very individualized and very personal. So in order to keep people connected, one thing is that each Zoom is 1 hour. More than 1 hour might have an effect. You've sat through meetings that are 2 or 3 hours, and you start losing some of the information as you get further in. So all of our sessions are 1 hour, and they're very interactive. It's not that someone is just staring at a screen. They're all greeted by name. They greet each other. And, you know, our music specialist will sing songs that he knows are relevant or favorites of certain of the participants, ask some of them to sing along or lead a song. And everybody is being constantly engaged, and our staff watch very closely on the Zoom and say, oh, I noticed so-and-so is not responding right now. I better ask them a question and bring them in. So they're very engaged.
That's good. I think a lot of business leaders probably need to take a lesson from what you guys are doing over there. So with that, how many people are typically in one of these Zoom meetings?
So we have anywhere from, we might have a small group one day that has 5 or 6 people, and we might have another group that has between 15 and 20. So it really depends on how they're feeling that day. Is everybody awake? Is there a care partner there that can help them log on and get them situated? So it's different every week, but we look forward to seeing them as often as we can.
What's this been like for your staff to go through this as well?
It's very difficult. It's very difficult. When you have a team that works with people living with dementia and their loved ones, part of your energy is drawn from interacting with your participants. It builds you up, it keeps you going, it maintains those relationships. So it has been very difficult, but everyone has worked very hard to maintain those relationships without being all in the same site. Our social worker makes phone calls to care partners every day and touches base. What do they need? Are there resources? And our staff has just done everything that we can to maintain that contact until we can be in person again.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. Debi Banooni with us here on the Megacast. She's the director for the Brown program. How can people find out about the program? Is there a waiting list, or is this a referral base?
So they can reach out to us. They can check out our Facebook page, looking for the Brown program. We do record all of our Zoom sessions with our participants. They've all signed releases, and we put little snippets up. So anybody that's interested can always check us out on Facebook. They can also send an email to myself or my social worker. I don't know if that's information that you put up or you'd just like me to say it on air, or they can give us a call, and we're happy to talk them through the process and share how they can get involved.
So with that, Debbie, anything before we say goodbye that maybe we didn't ask that you want to share with us about the program?
No, I mean, I think we covered it. We're really trying to keep people engaged. We have people right now that are participating in our program that were not registered participants, and they're waiting until we're able to reopen. So you do not have to be a current participant to get involved. And really anyone who's living with dementia, we welcome them, and we try to find out what it is and how we can help them live their fullest life.
Debi Banooni with us. She's the director of the Brown program, joining us today on the Oakland County Megacast. And Debbie, for those that aren't involved in the program, that have family that they're either close with or are maybe living with that may have dementia, you mentioned earlier on that isolation can have a detrimental effect on keeping up with their dementia and keeping them improving. What can people do at home with their loved ones or by visiting their loved ones to keep them engaged during this pandemic as this goes on, so that progress that they're making in treating their dementia doesn't have a hiccup because we're all isolating because of COVID?
So continued interaction is very important. Music has been found to be a major trigger for people living with dementia. So playing familiar music, singing, clapping and things of that nature. You want to make sure that there's continued physical movement. So if you play some familiar music and you clap your hands together or raise your arms above your head, kind of stomp your feet, and there are puzzles that can be done, anything that can continue to stimulate the brain and to encourage people to interact and keep moving within the realm of what their abilities are. You don't want to build frustration. You want to build involvement and interaction.
Such great advice. We so appreciate your time with us today, Debbie.
Thank you for having me. I appreciate it.
And thank you to your team. I know this is a tough time for everyone to try to continue to navigate this, but hopefully we are on the back end and we will be out of it soon.
We are looking forward to that.
We're going to take a quick break here on the Megacast, and when we come back, we will be speaking with the event director for Literati, the bookstore in Ann Arbor. This is the Oakland County Megacast.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/containcovid.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Parks COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on, to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Great to have you with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. Happy Monday to everyone out there. The sun is shining. It is supposed to get up to like 60 degrees today, Tyler.
Yeah, it's supposed to be really nice all week long. With just a little bit of rain on Wednesday, I heard. But, I mean, other than that, mid-50s, early 60s. It's looking up. Things are looking up.
It's looking up. The vaccine is out there, and hopefully, eventually, we'll be able to get back to life as we once knew it. One of my favorite things to do was to go to bookstores and just peruse the aisles, because yes, we can order everything online, you can download things online, but it still is not the same as going to a bookstore and exploring for yourself. With us now on the show is John Ganiard. He's the event director for Literati Bookstore in Ann Arbor. So great to have you with us.
Thank you for having me. I'm happy to be here, and I'm also looking forward to hopefully getting some t-shirt weather practically today.
Yes.
You know, it's so funny because it's all about perspective, right? When it's the end of the, when it comes like June, July, August, September, and you have a 50-degree day, you're freezing.
Yeah.
But here, if we have a 45-degree day after,
Open the windows.
Yeah, right?
Jump in the lake, yeah.
Especially after February. It was cold and snowy in February. So tell us, are your doors open to visitors yet?
Well, I was just thinking about that. But they're not before I came on, because this would be a day where we would prop the front door open and let some cool air in. And it's been in about 4 or 5 days, coming up on a year since we closed the bookstore to the public, and had since then have been doing strictly mail order, and then we got a pretty robust curbside service underway. So we're not open to the public yet for browsing, and I know that there's a lot of businesses in Michigan that are open and limiting their capacity, but Literati is a small store, 4,400 square feet across 3 floors, and it always thrived on being kind of cramped, intimate browsing. It's kind of like the appeal. Of course, you don't think about having that go up against a global pandemic, so we're still trying to reconstitute the store to make it safe for in-person browsing, and the goal is to be open in the spring and summer when there's warm weather, and we can keep our doors open and get some extra ventilation going and our windows upstairs. So for now, we're still running with our curbside service and shipping books anywhere in the United States. But yeah, this is just one of those days where, it seems like not too long ago where you would prop the front door open and get that breeze in, and just kind of a magical bookstore feeling that we're hoping to get back very soon.
Yeah, because I always, it's more than a bookstore. It's really a meeting place and a gathering place. And so retail stores can be open right now at 50% capacity, but it's like you said, it's how your store is laid out. Because I will say, even though they like to put the footprints on the aisleways to say, you can only go this way, no one's looking.
No one's looking at the crowd. Yeah. And I think we'd rather have us be open in a way that, obviously we're gonna abide by capacity guidelines and things like that, but in a way where people can, move about organically through the store. And right now we just don't want to put our staff at risk or other customers at risk by, just not having the capacity to patrol that the way a grocery store can, the way other stores, other essential businesses have been able to, and other smaller retail spaces. And so, it's slow going, but when we open, we want to know that we're opening with the goal of, with each progressive week that we're open, so the situation is improving. And so we're loosening and not tightening those guidelines that we have in place, I would imagine. I'm a little removed from those day-to-day operations as the event director, but I know that our owners are diligently working to reform the space a little bit and get ready to browse. And it's tough too, because our curbside operation, if you go to the store, we look like a shipping fulfillment center, because that's why we are. Our booksellers are up to their knees in bubble wrap and boxes and things like that. And so it's also a bit of transitioning away from becoming basically an online retailer back to being a brick and mortar bookstore.
So John Ganiard with us here on the Megacast. He's the event director for the Literati Bookstore in Ann Arbor, an independent bookstore. So with that, how is business? How are you able to keep the doors open?
Well, part of it is just having really an amazing community and support from our customers in Southeast Michigan. Since we closed, things looked really dire for small businesses across the board, across the country, who closed, and our owners worked hard to marshal support through a GoFundMe. Our booksellers worked hard, like I said, changing the entire makeup of the store to run all of our sales through our website for curbside and online shipping orders, and that's no small feat when 99% of your business is customers going through your cash register in the store to that point. And for my part, trying to, as you mentioned, Literati is a third space. We're a community gathering space. It's a little bit more than just being a retail business. And so flipping our events over to a virtual space and continuing to have Literati be a conduit for connections that readers can make with the actual authors of these books. And as a general interest bookstore, that means, novelists, poets, and also journalists, nonfiction writers, memoirists, cookbook authors, sports writers, etc. So keeping our mission going as a community space really helped. And I think it's just been a lot of support through, obviously we've seen a lot of upheaval in the past year through the uprisings in June, through natural disasters that our country has suffered, and books have been an anchor for folks in those times, especially in isolation. And I think there's been this rising understanding of the importance of shopping local and supporting independent businesses, and that has all come together to really keep us afloat and keep us, it's going, really. I mean, from a morale standpoint and also from a business standpoint, we're just so grateful for that. Events sort of slowed down in December, and I was in the store helping my colleagues pack up holiday orders, and being able to pack up 400 individual orders in a week, I felt good. I mean, it was different, not what I expected the holiday shopping season to look like, but it felt great to be able to have that amount of work to do. I knew it was a good sign.
So you are the event director, but how do you stand out in the middle of a pandemic, but you're also up against Amazon and some of these other major big companies where it's so easy to go online and click and order that book and have it shipped directly to the individual that you're sending it for. So how did you compete in that world?
Well, I think a lot of bookstores will just tell you that they can't compete with Amazon, and we can't because they've all long offered books as a loss leader, and we can't compete with that. If we priced books the way Amazon did, we would make no margins, and a small business cannot not make profit the way Amazon could not make profit from book sales. But we can compete with them from a customer service standpoint and from the standpoint of providing community. We individualize every aspect of our operations and business to cater directly to our community. We run events that our Southeast Michigan we think is interested in seeing. We make connections between local authors and local personalities and national bestsellers and national authors. And we provide, booksellers hand sell books to customers. They provide personalized recommendations. They'll listen to you, tell you what they read, and they can make recommendations human to human, which is a little bit different than an algorithm telling you what you might like to read because you read this, this, and this, because it can provide unexpected results. And we think that that's more valuable. So it's not so much competing, but separating ourselves as a business, and also providing that level of community and local connection that a big box retailer or a large online retailer just can't provide. And that's why all of our operations in the pandemic are still rooted in providing that exact service, to the point where we set up virtual bookseller appointments where you could connect with us on Zoom and tour around the store and have a bookseller talk to you, hear what you've read recently, give you some recommendations of what staff's reading, and you can have that one-to-one reader to bookseller relationship even while you can't physically be in the store.
That's really interesting, John. John Ganiard with us. He is the event director at Literati Bookstore, because we spoke recently with the Ann Arbor Book Society, and they had said that so much of the book community, the reading community in Ann Arbor, is about communication between readers, communication between stores. How has engagement been with your regular book readers and book purchasers, and in the community just in general in Ann Arbor, doing these virtual events? Has the response been similar to what it would be in a normal sense?
It's both the same and different. We do, I think since we started doing virtual events, our first was on April 3rd of 2020. I think we've done about 170 or so author events, and then maybe another 30 or so book clubs. And when I run our author events on Zoom every night on weeknights, I will see in the attendee room of the webinar a lot of familiar names of customers and of folks who long attended our in-store events. And then I'll also have people writing in the chat or sending us messages saying, I live in Guam and I don't have an independent bookstore. Wow. And you're my independent bookstore now. And so that has been the cool thing about this. I mean, I always tell authors every night that we get a chance to fold the map, as it were, because we could have one author in California talking to another author in New York City, and we don't get to do that always. I mean, we're lucky enough to be a bookstore that had a large event profile that we could get Margaret Atwood in a 1,000-seat theater or get David Sedaris to come read inside our very bookstore. But we don't have the opportunity that coastal bookstores have to have authors in conversation in that way. And so that's been new too. But the response has been the same, which is that our community is tuning in, and like I said, we get a chance to expand that community nationwide, and that's cool too. And I think other bookstores are doing that as well, and that's what really heartens me. Is not just how Literati can get its name out there for any people who, once we're able to travel again, might be coming through Ann Arbor or bringing their kids to visit the University of Michigan, is that people can learn about other bookstores and other communities, because there's a lot of great bookstores out there, and they're struggling to stay alive right now and doing things exactly what Literati is doing. And so, yeah, it's a crowded marketplace of virtual events, but the fact that we all get to sort of distinguish ourselves and make ourselves known to wider audiences, I think is sort of a rising tide that raises all ships.
So do you think that's going to stick around post-pandemic?
Yeah, absolutely. We talk about this a lot, and when I sort of informally have conversations with peers who have my position at other bookstores, with publishers, is that I think I was joking the other night that it seems like, bookstores are discovering the internet, which is maybe something we tried to stay clear from as a purveyor of an analog technology. But we're archiving all of our events, or a lot of our events, on YouTube, and seeing a lot of residual views there and building a lot of channel subscribers, and that's really cool. And we're in Ann Arbor, so a lot of our customer base are people who are moving through the University of Michigan, and that's the largest alumni base in the country. And those people don't stay in Ann Arbor; they go literally all over the world once they leave Michigan. And so we're finding that this is a way to stay in touch with people. And I think there's going to be a hybrid down the line of, there's nothing like an in-person event, whether that's an event in a large theater with thousands of people, or an event in our bookstore with 20 or 30 people on a really intimate snowy evening or late summer evening or something like that. But there's going to be a little bit of both. I think we'll continue to do Zoom events or select webinar events when maybe an author's based overseas, and it doesn't make sense to fly them out there to have certain conversations, to do stuff to supplement that. I think we're going to have to find a way to stay connected, because we can do it without sacrificing what we are at bottom, which is a brick and mortar, independent, downtown bookstore.
John Ganiard with us here on the Megacast. He is the event director for Literati Bookstore, an independent bookstore in downtown Ann Arbor. What's it been like for you guys, though? Because so many of the students right now are not in Ann Arbor. They're not. They're virtual. They're remote.
Yeah. There are some students on campus. I mean, we were kind of like a meeting space for a long time, for students. And I go downtown occasionally to go to the store to ship out books and do some other stuff in our office. And downtown is still kind of teeming despite everything, which is nice and sometimes a little bit scary to see. I'm happy for our restaurants, our neighborhood restaurants, though. It's weird. I mean, it's eerie to go into a quiet bookstore that's been empty for a year. It's just not normal. And I think people are eager to come back, because even though we're close to the public, sometimes people are still following our booksellers into the store as they bring books over from our office or something like that. And we have to tell them, like, oh, we're not open just yet. People want to come back. So it's odd. But I think we're just, like I said, we're doing everything we can to stay in touch with our community, whether it's through events or virtual book selling appointments or book clubs. And it's also just great to have, to still have like people wave at us through the windows, or I don't know, just the cool ways our community has been able to support our booksellers while they're in there working hard on curbside orders and everything else that they do has been great. So I think it's weird and it's unnatural, but we all sense that community is ready to come back. It'll be a little bit different at first. It won't feel like it did until who knows when, back when it's safe to have every student back on campus, and until it's safe to have restaurants open 100% capacity and all the rest when we're all nice and vaccinated. But it's not the same, and there's that trepidation, and it's, the lights are off most of the time in the bookstore, but I don't know. You can just kind of see it around the corner.
Well, hopefully the corner is there, like right here. I will say, it just came out. The CDC just released fully vaccinated people can gather without a mask and should still cover their face in public. So the CDC just releasing those mandates a few minutes ago. So that's good news for like your company. People will be able to come back. They can gather together. They don't have to be socially distanced if they are fully vaccinated, because I know it's going to be a while for a lot of the population in Ann Arbor with the students. They'll probably be some of the last ones. But, hopefully by the summertime, they're saying that, they're hoping May, everyone in Michigan that wants to be vaccinated can be vaccinated, because there is nothing better than going to a bookstore and getting lost. I mean, really, like you can look, right? There are advantages to both worlds. It took me a long time to get used to reading my iPad, and they even put the little sound on turning the pages. It wasn't the same. It's not the smell. But there's something about getting lost in a bookstore, and that's where you really discover new authors and new genres that maybe you wouldn't go to online. So we can't wait for you guys to reopen your doors.
Thank you so much. We can't wait either. And if there's one thing I can communicate to the public, it's just that we're doing our best to make sure that when we do it, we're doing it safely, and we're doing it for the long term, so that we don't have to close down again. So we can't wait. I mean, it's almost like people are like just kind of putting their face to the glass and looking in on us, ready to return, and we're ready to have them back, and we're excited and optimistic about what's happening with vaccines and everything else.
So John, with that, before we say goodbye to you, anything that you want to add that maybe we didn't touch on?
Yeah, sure. Just that people can stay in touch with us by shopping online at our website, and that's where all of our events are as well. We do We basically do an author event on Zoom every weeknight, totally free. And then we've got a few ticketed events too, where you buy the book and you get access to an exclusive virtual event. And that's all on our website at literatibookstore.com. And you can sign up for our newsletter there as well. And if you want to stay in close touch about what's happening with events and also with the store as we work to reopen, that's the best way to stay in touch with us. And also just thank you to everyone who's bought a book, everyone who's come to a virtual event, anyone who's waved at us through the window. I have a lot of hardworking colleagues at Literati who put a lot of blood, sweat, and tears into the past year, and I'm so grateful to know them. And their jobs wouldn't be possible if it weren't for a really loving and supportive community. So we just can't thank Southeast Michigan book lovers enough.
Well, we know there's been a great, a big support in the beginning and the campaigns to shop local. We need people to continue to do that, because even when so many of the businesses and the restaurants are able to reopen at full capacity, it's still going to take quite some time to get back to where you guys were before. But we're so lucky to have you in the community.
Thank you. And thanks for having me on the show. And thanks for doing what you're doing and talking to folks like us. We really appreciate it.
No, and just think about all the new authors you're going to have coming up, because everyone's been at home writing books.
Yeah, it's going to be a glut. We're going to be bursting at the seams with the Pandemic Project books. I'm excited about it.
There you go. John Ganiard with us. He is the event director for Literati Bookstore in Ann Arbor. Take time and check them out. Order just one book. Just one book. Support them. Support everything that they are about. We're going to take a quick break here on the Megacast, and when we come by, Jim Dexter will be joining us. He's with the Fisheries Chief with the Michigan Department of Natural Resources. This is the Oakland County Megacast.
89.3 Lakes FM invites you to submit nominations for the Greater West Bloomfield Michigan Week Community Awards. Now until Monday, March 8th at 11:59 p.m. Nominate someone you know in the community who is making a difference in Greater West Bloomfield, as we celebrate our local volunteers. To learn more and make nominations, visit MichiganWeek.org and join us for the Michigan Week Community Awards May 19th on 89.3 Lakes FM.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1. Turn on the sink and wet your hands with warm water. Step 2. Apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3. Wash your hands by scrubbing them together for at least 20 seconds. Step 4. Rinse your hands with warm, clean water. And Step 5. Dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6. If you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Welcome back to the Oakland County Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. You can always catch us Monday through Friday, 10 a.m. until noon, Civic Center TV, Birmingham area municipal access. You can tune us into Channel 15 on Comcast, 99 on AT&T, or listen to us on the radio, 89.3 Lakes FM, 88.1 FM The Biff. And then we also do post full episodes on our website, civiccentertv.com. So big news just coming out from the CDC. Tyler, the Centers for Disease Control and Prevention just released guidelines designated to ease the restrictions for Americans who are fully vaccinated against COVID-19. So the agency's guidelines state those who have received a full course of COVID-19 vaccine may get together with other fully vaccinated individuals in small groups inside their homes without masks or physical distancing. They can also visit people with unvaccinated people from one other household who are at low risk for severe disease. The guidelines also say fully vaccinated people don't need to quarantine or take a COVID-19 test if they've been exposed unless they are symptomatic. So this seems to be going in a total different way, because they were telling people even after you've been vaccinated to continue to wear your mask, to continue to be socially distanced. The CDC can just now releasing those guidelines, and will continue to follow that. So some big news on the vaccine front. But this is still in the middle of the pandemic, and while we are hopefully are on the end of it, we're still in it, and that means so many of us have been getting outside, enjoying nature. With us now, Jim Dexter. He's the Fisheries Chief for the Michigan Department of Natural Resources. So great to have you with us.
Good morning, Ronnie. Good morning, Tyler. Glad to be here.
So here in the West Bloomfield area, we have so many lakes surrounding us. And from all the ice shanties I saw on the ice, especially in February, it looks like it's been a pretty busy season out on the waterways.
Yeah, it has been. And a lot of that was pent-up demand. When we were on the radio previously, we had talked about how climate change has had effects here in Michigan and throughout the country and the world. And we had a much, much shorter ice fishing season. There's many years we can get out before Christmas. This year it wasn't until really mid-January that things got safe. And now ice is really breaking up fast. I mean, it's going to be in the 60s this week. We're going to get rain. I've got tulips popping up in my yard already. Spring is around the corner. But yeah, people did get out. Fishing was good in certain areas. In southeast Michigan, there was a great perch fishery over on Lake St. Clair. People had still been getting out this past weekend on some of the inland canals, but that water or that ice is going to be disappearing. And we now have boat activity on Lake Erie. People are going out and trolling for walleyes already, and they're catching those fish. So that's great. It's great that people are getting out there and taking advantage of these first really nice days that we've had this spring.
So one thing I've noticed, because it seems like the thaw was pretty quick. We had those extremely cold temperatures in February and great ice, but then boom, it hit. And now I'm seeing a lot of situations on the lakes around us where people had built like those little ice rinks or the ice shanties, and they haven't gotten them off the ice yet. So what happens? Do you guys typically find a lot of that stuff like in the waterways after a season?
Yeah, that does happen. If people put a permanent, we call it like a permanent ice shanty out there, they have to have their name and address on it so that if they do go through the ice, they can be retrieved and the officers can figure out who it is. Maybe they're going to get a ticket because they left it out, but there is a law that says that they have to be removed by a certain date. And I believe, I should have been prepared for this question. I believe it's March 15th down here, and it's later up in the Upper Peninsula where it's a little colder and they've got more ice.
Yeah, well, it's hard to tell each year too because we haven't had the ice, or at least I don't remember. Like the last couple of years, it didn't seem like we had as much ice, really, for so much ice fishing, at least around here, like we did this year.
Yeah, it's been difficult the last several years. The weather's been pretty flaky, warm Novembers, kind of mediocre Decembers. Then you get blasted. I think it was last year we had the polar vortex for a couple of weeks. It was worse than what it was this year. Lots of zeros, and that makes good ice. That can make for tough fishing though. But a lot of people, when they go out and fish these days, they've got portable shanties. They can pull them out on a sled. They take them out in the morning, they remove them in the afternoon. So there's not as many of those shacks that are left out there, to go through the ice. And the anglers are really pretty good about it. There might be a hockey net or two that might go through.
Right. Jim Dexter with us here on the Megacast. He's the Fisheries Chief for the Michigan Department of Natural Resources. Jim, we were at Dodge Park the other day walking the dog, and you do start to see some of the fish along the the lake line there that have died. And as a reporter, I remember there were always those stories right around springtime where people were concerned about the big fish kills. Explain that to us.
Yeah, that's the most common type of fish kill that we have. We call it winter kill. And it happens once you have ice on the lake. Remember that in the lake there are plants. The plants are making oxygen for the water. So once you have the ice cover. There's no more oxygen exchange between the air and the lake. You've got plants making oxygen and using oxygen at nighttime. And then when you get snow on top of that, it cuts the light. And so now the plants can't make the oxygen. So the oxygen levels in the lake start falling. The fish are starting to get a little more stressed because it's springtime and it's spawning time for a lot of fish. And so you typically see this in shallow impoundments, shallow ponds, canals, anywhere where it's shallow and there's some weed growth and there's not an area where fish can go to get good oxygenation, deeper water where there's still some oxygen left. Happens every year. We get lots of calls. We always put out a news release that explains that this is a natural phenomena. Sometimes you only see one type of fish species that are more sensitive. Other times, if it's really bad, you see everything. And we've already been experiencing some fish kills. As you mentioned, Dodge Park, that's a new one that I haven't heard about, but I know that there's been some fish kills going on over on Lake St. Clair and some of the canals. And this happens every year, and it's part of nature.
So when someone sees that, is there any environmental risk to the public? Or it's just nature? It's just nature.
It's just nature. It's going to stink for a while. Some of these fish have been dead for weeks. They might be fuzzy because they're growing fungus, and then they blow it up and they come to the surface. But eventually, you know, the critters start coming out from this winter. They're going to eat some of those fish. Fish are going to go down. Sometimes these kills can be pretty big, but a lot of times they're fairly localized and they don't usually take out the whole population. We do like to know when these types of things are happening, and we have an area on our DNR website called Eyes in the Field that you can report fish kills, and we will look into them just in the event that there's some type of other environmental issue that might be causing that fish kill. And fish kills can also occur in the summertime too. I might as well mention that at this point, you know, because typically late May, early June, temperatures are really rising, fish are spawning, plants are actively growing, and a lot of times on our inland lakes we have weed treatments that occur to remove some of the noxious weeds. And when that occurs, the weeds are dying, decomposing, using oxygen, and you end up with a springtime fish kill, not a winter fish kill. So that's pretty common also.
So I'm just thinking, because I know as a reporter, like I said, the newsrooms, the phone lines used to ring off the hook. So I'm sure it happens with you guys every single year as well. So if someone comes across something like this, is it better just to report it to someone? But they don't want to try to clean it up, right? This isn't something for the public to clean up.
Right, yeah. You know, I mean, if there's a few fish, you know, we don't need to know about that. We want to know about lots of fish, you know, big fish kills. We'll come out and take a look, either a conservation officer or one of our biologists. Most times people would not want to clean that up, and they ask us to clean it up.
Right,
That's
it's the smell. Like, you know, just thinking about it, like you can smell that smell, you know?
Yeah, it can get pretty bad, especially in the heat.
Oh, yeah.
Not pleasant, not pleasant. So what do you think? I think I saw a report where we all know that everyone's been outside so much more. Did you have an increase in fishing license this year?
Oh my gosh, it was huge. So we typically in Michigan sell 1 million to 1.1 million fishing licenses. That's what we sell. And then you've got, you know, anybody that's 17 or under does not have to buy a license. So there's all these kids that are out there fishing too. So let's just say we have 1.5 million people in the state that go out and fish. That's almost 15% of the population, which that's great. We had a 10% increase this past year in license sales, and that was uncharacteristic. The last several years we've been flat. You know, we go up and down 25, 50,000 licenses. But this year we went up 10%, which is very significant, well over 100,000 licenses. We had an increase in out-of-state anglers by about 2.5%. Wildlife Division also saw a 5% increase in hunting license sales, which is fantastic. So you're right. Everybody was getting outside because they were sequestered at home. What are they going to do? You're going to go for a walk in a park. You're going to go bike ride. You're going to go kayak. Let's go fishing. Maybe let's try hunting. And it's going to be real important and interesting to see if this translates into continued sustained activity this year. I hope that it does, because one of the good things that we found in our work is that the majority of our new license sales were in the younger folks groups, age 17 to 25. We saw a huge increase in what I would term brand new angler participation, people that have never gone out and done it before. And so I'm hoping that they're going to continue to do that this year. I know that the stores are all getting restocked. I mean, fishing season's coming up. It's right around the corner. April 1st is the beginning of the fishing year. We're already selling our new licenses for 2021. You can buy a license online, which makes it really easy. And I think that the stores will definitely be ready this year, because last year with all these new people out there, they sold out of everything. There were no rods, there were no reels, there were no kayaks, there were no canoes. Everything was gone.
Yeah, so, and the supply chain was broken last year as well because of the shipping. But can I ask a silly question?
There's no silly questions. Come on.
Wait for it.
Why do I need a license to fish? Can I just take a pole out, put it over the edge of the water, and hook a worm to it and catch a fish?
A lot of people think that. You know, there are people that think that, you know, fishing's all right. I can go out there and fish. But, you know, we tell everybody, no, it's a privilege. It's a privilege that you have to pay for. You have to follow the rules, and you have people that work in DNR Fisheries Division that work to manage those fisheries, to sustain them so that you have good fishing activity. Without that license support, there'd be no fish management. Our work is almost entirely funded by license fees. And we also get excise taxes from the federal government so when you buy a fishing rod, there's an extra 5% tax that the manufacturer pays once that rod is bought, that comes to the state to help us manage those fisheries.
So tell us again why it's so important to try to manage the fisheries.
Well, if we didn't manage them, if there were no regulations, no conservation officers out there to enforce the laws, there's a lot of very good fishermen out there. And they would take what we would call more than their fair share. You know, we have these regulations so that we can spread these fish out amongst the public, because these fish are owned by all the people of the state of Michigan. And my job as a trust manager is to ensure that those fish are available for everybody. And it's not just Ronnie that's out there getting all the perch in Lake St. Clair. You know, Tyler gets a crack at it too.
Yes, come on, Ronnie.
I told you it was a silly question. So Jim Dexter with us here on the Megacast. He's the Fisheries Chief for the Michigan Department of Natural Resources. As someone that is like an outdoors lover, you probably have the coolest job. What's it take to join the DNR?
Well, it is a great job. I mean, I've been in this business now this is my 38th year in fisheries. Once I got out of college, went to Michigan State. And it's always good to have a degree in fisheries, wildlife. There's a lot of different degrees you can have to get into this field. But most people in our field have a bachelor's degree in fisheries. And we have a lot of great colleges, universities here in Michigan that provide that background. Michigan State University, U of M, Lake Superior State, Northern Michigan, Michigan Tech, Central Michigan, Grand Valley State. They all provide this background, and we hire an awful lot of Michigan people that graduate in these fields. But it's very, very popular. Everybody wants to go out and work on a boat. Everybody wants to go net some fish. Everyone wants to go count bears or deer, you know, out in the woods. And so there's a lot of competition. There's an awful lot of competition. But if people get through college and stick with it, there's a lot of ways to get your feet in the door and to end up with an awesome career in natural resources. And we just have tremendous staff throughout the entire department, whether it's a forester, a wildlife biologist, fisheries biologist, a park ranger, a conservation officer. There are opportunities for people that have only a high school degree all the way to doctorates. I mean, we cover the field, and it's certainly an awesome place to work.
Yeah, in the state of Michigan, we have such a diverse landscape and a beautiful countryside, and we're lucky to live in this state. Do you anticipate it's going to be another busy year?
Oh, yeah, I absolutely do. I I think that based on the activity levels that I'm hearing right now, you get this good weather, people are out there. I mean, I was stunned to hear that people are already practically breaking ice to get their boats out on Lake Erie to catch some walleyes. But that's what they've been doing, and we've got a lot of steelhead activity right now. And you're right about our diverse landscape, Ronnie. We have over 4 million acres of state land in this state, we have more state land than any other state east of the Mississippi. And within that land is a lot of lakes and thousands of miles of streams and rivers. And we have so many different opportunities, whether you want to fish catfish, you want to fish for trout, for steelhead, for salmon, you want to go hunt bunnies, you want to shoot deer, you want to shoot grouse. We've got the property that those activities can occur, and people do take advantage of it. I absolutely think it's going to be a busy year again this year, and we're ready for it. We're getting ready to stock fish. We start stocking fish here in about 2 weeks. That'll take about 5 or 6 weeks, but we'll be putting out about 20 million fish all around the state to help maintain the world-class fisheries that we have.
Where do you get your fish?
Where do we get them?
Yes.
We have 6 fish hatcheries, and they are located in Kalamazoo. We have 3 up around Traverse City, and we have 2 in the Upper Peninsula. And these are factories, and this is where they're primarily salmon and trout facilities, although we are just completing our first what we call cool water facility up in Manistee, where we will raise walleye and muskellunge to be stocked throughout the state. So that's very exciting to have that new facility come online here just in the next few weeks. But these facilities are operated by, we have 48 full-time staff that are dedicated to fish culture and fish health. We have maintenance mechanics that keep all the motors running and the pumps running and the water running. And we produce some very, very healthy fish, whether it's steelhead, Chinook salmon, coho salmon, brown trout, walleye, muskie. We run the gamut with about 13 species total. And those folks are very dedicated, and they help maintain our fisheries. I do want to put in a pitch on our most latest endeavor that we're doing, and that is we have a program that we have started to bring back the Arctic grayling, which is an extinct fish here in Michigan. It was a native fish, and it was very ubiquitous throughout the lower peninsula in the 1800s. But excessive logging and commercial harvesting on our rivers decimated them, and they disappeared. The last one was caught in 1936. We've tried several times in the past 100 years to bring that species back, but there's new science on board, and we are working down a long-term, very well thought out path to bring that species back to the state. And we just started our first brood stock to take eggs. And I would love to come back on in another day and talk just about Arctic grayling, because it's a very exciting fish. And I can't do it justice in 3 minutes.
Well, we wish you the best of luck on that project, and we always welcome having you back as well. We so appreciate your time this morning. Jim Dexter with us here on the Megacast. He's the Fisheries Chief for the Michigan Department of Natural Resources. Thank you again for your time this morning.
Thank you, Ronnie. Good to be with you. Bye-bye.
We're going to take a quick break here on the Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
just about 15 minutes left here in the Megacast, and before we say goodbye for the day, we are going to welcome in Todd Shackelford. He's the Distinguished Professor and Department Chair over for the Center of Evolutionary Psychological Science at Oakland University. Great to have you with us, Distinguished Professor.
Thank you. I'm very happy to be here. Thank you.
Can we start off just by sharing with us exactly what is evolutionary psychology?
Sure. Well, evolutionary psychology is really, it's more of a perspective than it is of a particular field. And so basically what we do as evolutionary psychologists is we study the way the mind works. And we do so with an explicit recognition that humans have an evolutionary history, as does every other form of life, and that sometimes it can be very useful to ask questions about the evolutionary history of humans if you want to understand why we think and feel and act as we do today.
Well, you have a lot of history to go on and a lot of new material coming out of a pandemic.
Indeed, yes. And in fact, zoonoses, or transmissions of disease from non-humans to humans, there's good evidence that, this has been part of our evolutionary history for, as long as we've been humans, certainly, and likely before that. But yes, there's been a lot of interesting work coming out, specifically related to how humans address and deal with, pandemics.
Well, we're hoping not to have another one for another 100 years, fingers crossed. But so there is a new Center for Evolutionary Psychology Science over at Oakland University. Tell us about the center. How did it come about?
Sure. Well, let's see. How did it actually come? Well, we've been talking about it. I got here to Oakland University in about 2010, and we've since hired several new faculty. And I think we reached a point where there were a number of us that were very interested in applying an evolutionary perspective to humans. And I think we just reached a critical mass where it made a lot of sense. And I had some discussions with the Dean of the College of Arts and Sciences and the Provost and the President. And they were on board and they thought it was a great idea. And it's really taking advantage of the resources that we already have here in terms of our faculty and students. So it was an opportunity to just kind of formalize what was already in existence.
So tell us more about the center. Is it open to the public, and what will they experience and see if they visit?
Well, that's a great question. I mean, in fact, the Center for Evolutionary and Psychological Science is really, at this point, it was just founded in January, and it really turns on academic experiences, for example, for students. And so, for example, we'll be offering courses, and we do offer courses specifically related to evolutionary science and evolutionary psychology. And we've talked about formalizing it in terms of offering a minor. We certainly have we have existing relationships with various community agencies, mostly by virtue of the kind of research that we do. And I'll just note that one of the things we really want to be able to do is to bring some of the science to the public. And so this would include hosting international conferences, which we have done over the last few years. But we want to basically be more explicit about reaching out to the public and to the community.
So with that, because there's a lot of new material for you and your fellow professors to study coming out of this time period that we've been in. What's it been like for you as a professor during the pandemic?
Well, it's been very interesting. It's always interesting, but it's been interesting in different ways. One of the things, Oakland University has done a superb job of, keeping things under control in terms of the pandemic. But most of our actually all of our courses in psychology, which is the department I'm affiliated with, those are all online, and they've been online since last March, basically. And they will continue to be online for the summer. Now, we have high hopes of coming back face-to-face in the fall. But that has been a challenge. Several of us, including myself, have not taught online before. So it's been very interesting, and it's taken a lot of getting used to. But so far, so good. Although I must say I am looking forward to getting back to in-person courses.
So what's been the response from your students about the announcement for the center?
They have been so excited. And so, we all sort of think of our group as a center of sorts, although there was never any sort of formal center. So I think it's really, for our undergraduates and our graduate students, I think it gives them a sense that we are officially a place, we're officially an area. And it's really nice, to have that kind of recognition by the university. It really sends a message, I think, to the rest of the academic community and, to various stakeholders that evolutionary psychology is an interesting area and it's an important area. And that's sort of the implicit feedback.
Do you think kind of going through this pandemic too has helped foster the study and the work that you've been doing?
I think in some ways it has. I think it has in the sense that a lot of our work, which used to be in person, of course, we're not collecting any in-person data right now. We're not doing any in-person research, but a lot of it has now gone online. And I think has opened up some doors that we hadn't thought of before. And it's opened up, it's given us an opportunity to ask different questions than we might have asked had it been limited to in-person. So I think we've all kind of taken it in stride. And I think, we love what we do, and we simply had to figure out a different way to do it.
Tom Shackelford with us here on the Megacast. He's a professor and department chair for the Center for Evolutionary Psychological Science over at Oakland University. And Professor, do you think because of the pandemic or some of the things that we've been going through, more students may be interested in going into this field of study?
I think that is a possibility. I think it's caused people, not just the pandemic itself, but I think some of the consequences of the pandemic, for example, the greater access to online sort of social communities. I think there have been concerns raised about social isolation, physical isolation. And I think all of these are some of the sort of the cascading consequences of attempting to deal with a pandemic that I think many students and many faculty have found interesting questions to ask in these areas. So I think you're absolutely right.
Tom Shackelford with us here on the Megacast. Just another minute or two with us here on the show. How do you think having the center is going to benefit the students? Do you think it's going to help you attract more lecturers and guest speakers?
I do, and that really is part of the reason for sort of formalizing it, is that once you have a formal center, again, that sort of says something about the commitment of the university to that particular area. And indeed, that is, and I've appointed, a group of people who serve as external advisors, people from all over the world who basically are committed to what we're trying to do here and are interested in what we're doing. And I think many of them have already agreed to give talks just to let them know, and they're ready to roll. So I think you're right in that.
So one thing that has been good coming out of the pandemic, we're all Zoom experts now. So it'll be easier to bring in some of these people to expose your students to their knowledge and their expertise, because we all know how to use Zoom now.
Well, that's a great point, and that's absolutely true. And in fact, I think another thing we've all realized is that, it can be a wonderful experience, meeting with somebody on Zoom, and it can be just as personal. I think it's different than, sitting down to lunch, for example, with someone. But I think you're right. I think we've all come to appreciate what is available online or by Zoom or Skype that I think before the pandemic we would have thought, oh, well, that we wouldn't want to do that. That wouldn't be, that wouldn't be real enough. But I think we've discovered that it is, and it can be really interesting.
Professor, before we say goodbye to you today, anything maybe we didn't ask that you want to share with our viewers and our listeners before we say goodbye?
Yeah, I'll just mention that one of the other things that I wanted to note about the Center for Evolutionary Psychological Science is that one piece of what we also are interested in doing is continuing to engage in outreach with the community. So several of us have given talks at local high schools and middle schools about science and about evolution and about how people think and feel. And that's been really, really interesting. And I, for one, have had high school students in my undergraduate courses and, in fact, in my graduate course. Got some smart kids out there. So that's a lot of fun. We all sort of enjoy that immensely.
there are some smart kids and some great programs too with some of these high school students being able to attend college. So they're lucky to be able to take one of your classes. I'm sure it's very engaging and very thought-provoking as well. So we so appreciate your time with us here today.
My pleasure. Thank you so much for having me.
Again, do you have a website if people want to learn out, find out more about the program?
Yes. If you go to Oakland University and the Department of Psychology, you will find the Center for Evolutionary Psychological Science along the left-hand side of the menu.
Okay, great. Thank you so much. We appreciate your time again.
Thank you. Take care.
Professor Todd Shackelford with us. He is the Department Chair for the Center for Evolutionary Psychological Science over at Oakland University. Thank you for your time. Just about 30 seconds here left on the show. I want to say, again, just remind everyone there are some new CDC guidelines going out about the vaccine. We'll continue to monitor that and hopefully have another expert on later this week. But that's pretty much going to do it for us on this sunny Monday afternoon. Get out, enjoy the weather. Stay safe and stay healthy. Thank you for tuning in to the Oakland County Megacast.